Hi, I'm Melissa. I'm a student nurse practitioner, and I'm going to be doing an assessment on the musculoskeletal and neuro. And this is my patient, Curtis. I'm going to start from head or shoulders to toes. So I'll start with the shoulders. If you can raise your arms up, this is testing the abduction of the shoulders. And then if you can adduct them down and cross them in front of you, very good. And then if you can internally rotate your shoulders, and then external rotation by raising your arms back. And if you can raise up your shoulders again, and I'm going to test for muscle strength. Straight up, very good, and then down, very good. Internal rotation, great, and external rotation. So go ahead and back, very good. And as I am testing for muscle strength, I'll also be testing for any temperature changes, any instability, swelling, masses. I'll be looking at the tumors, symmetry, things like that. Now we'll do the Hawkins test. So this is to test the rotator cuff if there's a tear. So go ahead and raise your arms up 180 degrees, then lower them to 90. If one of the arms falls, that's a positive Hawkins test, and that's indicative of a rotator cuff tear. Go ahead and lower your arms. Now we will test the elbows. So go ahead and do a bicep curl all the way up and all the way down, and that's testing flexion and extension. And do it against my hands so I can test for muscle strength. Very good, and push down. Very good. Now I'm going to do some deep tendon reflexes. So we'll start with the brachial. Go ahead and flex your arm up for me. Okay, very good. Go ahead and relax. Nice and loose. Okay. There we go. And the brachial radial. And we'll do the tricep. Go ahead and relax. Okay. There we go. And then I will palpate the medial epicondyle and the lateral epicondyle. And then the olecranon process here. Good. And the ulnar nerve, which should be right in this groove here. Very good. I would do that bilaterally. Can you hold your arms out in a fist? And we're going to test the supination and pronation of the elbows. Go ahead and twist your arms. Very good. Now we're going to move on to wrists and hands. So if you will flex your hands down at the wrist and extend them up. Very good. And then we're going to test your ulnar deviations. So go ahead and push your arms out, or your hands out, and then the radial deviation. Very good. Let's see. Now we'll do the fingers. So go ahead and abduct them. Spread them out and then adduct them and bring them in. Very good. And then we'll do just the fingers, and then down and raise them up. Very good. Then we will do finger grip. So go ahead and squeeze my fingers nice and tight. Very good. Then we're going to do the thumb opposition. So go ahead and make an L with your hand. And then take your thumb and put it to your pinky. Very good. And that's testing the range of motion of the thumb. Now we're going to do a point-to-point localization. So go ahead and close your eyes. And I'm going to take your hand here and I'm going to touch your hand, and I want you to use this hand and touch where I just touched, okay? Very good. Now I will do the diagnosis and have you identify this object. Can you tell me what that is?
Paperclip.
Very good. Now I'm going to do graphesthesia. So I'm going to draw a number in your hand and you're going to tell me what it is.
6.
Very good. Then I'm going to do the proprioception. Yeah. And I want you to tell me, I'm going to take your finger and I'm going to go up, down, left, or right, and you're going to tell me where it is, okay?
Up, down, left.
Very good. And I will do that on both sides. See what else. We'll do the Fallon test, so go ahead and open your eyes. We're going to have you go like this, and this is the test for carpal tunnel syndrome. And if there's any pain with that, is there any pain? No. Now we'll do the smell test, so go ahead and relax. Is there any pain?
No.
No. Okay. Or numbness and tingling. If there was, then that means he's got carpal tunnel syndrome. Now I'm going to have you hold your arms out, and with your eyes closed, I'm going to touch either hand, and you tell me left, right, or both. Close your eyes.
Left. Both.
Okay, now I'm going to pinch you.
Left. Right. Both.
I'm going to use vibration, and tell me which hand.
Left. Right. Right.
Very good. All right. I would like you to touch your nose, and then touch my finger, and touch your nose, and touch my finger, and touch your nose, and touch my finger. Okay, now close your eyes, and I'm not going to move my finger, and you're going to touch it. Okay, so touch your nose, now touch my finger. Very good. Now we're going to test your gait, and I'm going to be looking at your posture. Go ahead and open your eyes. So I'm going to have you walk to the end of the hallway here. And turn around. I want you to walk heel to toe. So put your heel to toe. Okay. So go ahead and walk down the hallway. I'm checking his cerebellar function, making sure that he's not falling and swaying everywhere. Okay, go ahead and stop. Now turn around. And I want you to do the same thing with your eyes closed. And I'll be right here to make sure you don't run into anything. Okay, go ahead and stop. Turn around. And come on back. Or you can open your eyes and walk back. All right, now we're going to do the Romberg test. So go ahead and let me step back just a little bit here. Have your feet together, arms at your side, and go ahead and close your eyes. I'm going to look for any swaying. Okay, very good. Go ahead and open your eyes. Now, if you want to separate your feet a little bit, you can. And go ahead and put your arms out. This is for the pronator drift. And go ahead and close your eyes. And if one of his arms falls, that's positive. Very good. Go ahead and open your eyes. Now we're going to look at your back. And I'm going to be looking at your posture, head position, symmetry, all of that. So go ahead and turn around. Very good. And I'm going to have you bend over and touch your toes. And I'm going to lift up your shirt here. I'm going to be looking at the curvature of his spine to see if there's any scoliosis or kyphosis. Go ahead and raise up. And then I'm also going to be looking at the curvature of his whole spine here and making sure there isn't any real apparent lordosis or kyphosis than normal. And he looks great. Now I'm going to look at the symmetry of the scapula, ribs, and hips. And he would be in a gown. I'm going to lift up your shirt here. I'm going to look at the scapula. And I'm going to look to make sure that the inferior angle are level. And I'm going to look at the iliac crest. Make sure those are at about L4. Make sure they look symmetrical. Very good. And if you will do, so we already did the flexion. So go ahead and let's stand sideways. Lean back and push back. Very good. And then if you'll turn back this way and lean to one side. Very good. And I will be looking at his hips as he does that and his back. Go ahead. Very good. And I'll do that bilaterally. And then if you'll put your hands on your hips and try and turn and look behind you without moving your feet, just your back. Very good. And I would do that bilaterally. Okay. Now we'll do the hips. So I will palpate the anterior. Go ahead and turn around for me. The anterior superior iliac spine. So right there. Very good. And then the iliac crest. Then if you'll turn backwards, I'll do the posterior iliac spine. Right there. I'll do that bilaterally. Okay, good. Thank you. Go ahead and turn around. Now we'll do the flexion and extension of the hip. So if you'll lift your leg up, so let's actually step back here. So go ahead and raise up your leg, and then go ahead and kick it back without bending over. Stay straight, so it's just checking your hip. Very good. And that's checking the extension and flexion of the hip. Now let's do the abduction and adduction. So abduct your leg, so pick it up sideways. Very good. And adduct, crossing your leg. Very good. Now we will go ahead and stay right there. We will do we'll do the Trendelenburg test. So if you will stand on one leg Very good. And that's to test his balance and that there's no leaning when he stands on one leg. So looking at the hips, seeing if they lean either way. All right, go ahead and put your leg down. Now we will go over to the floor here. All right, now we are in the supine position, and I would have him on a patient exam table, but I don't have one of those. So, first I'm going to do the straight leg raise. And I'm going to take his leg and I'm going to do passive range of motion, and I'm going to raise it to 30 to 70 degrees. And if he has any pain going down his leg or numbness or tingling, that's indicative of an issue in his L4, S2 area. Now, while we're down here, I'm going to do the McMurray sign. So I'm going to raise up his leg to 90 degrees. And then go ahead and relax. And I'm going to feel for any clicking and popping in his knee. And raise it down. And then we're going to go back up to 90 degrees. And outward. And it tells me if there's a meniscus tear. Then I'm going to have you go prone. So go ahead and flip over onto your stomach. Very good. And go ahead and lift up both your legs and put this down. Okay. He would be on a table and his legs would be falling off of the table. Now this is to check for an Achilles tendon tear. This is called the Thompson test. So I just grab his calf and make sure that his foot moves when I grab this, so his Achilles tendon isn't torn. And I would do that bilaterally. Okay, now we'll head on back over. Okay, come on back. So now that we're done with the supine test, we're going to test the knee. So go ahead and have a seat. And I'm going to first start by palpating his femur here. And then the patella. And then the tibial turbosity. All feels good. Go ahead and raise up the rest of your leg to 180, very good. And then hyperextend it back, so greater than 90 degrees. You may have to sit up in the chair. Very good. Any pain with that? All right. And I'll be comparing right and left, and for time's sake, I'm only doing it on one side. Also, when I was palpating, I was looking for any masses, any tenderness, any instability, the size, color, all of that. So go ahead and take your heel and put it on your shin and run it down and back up. And then we do that on both sides. Can you put your foot on this chair for me, please? I'm going to first palpate for the talus and the medial malleolus and the lateral. Then I'm going to palpate the tarsals and the metatarsals. Very good. All right. Now we're going to do dorsiflexion. So flex your foot down and plantar flexion up and do that with resistance to my hand. So push against my hand and push against my hand. Very good. And then we'll do inversion. So put your foot in and eversion. Very good. Now let's do your toes. So if you want to dorsiflex them down and plantarflex up. Very good. And then I'm going to palpate your Achilles. And then I'm going to test your Achilles. And then if you'll relax your leg here, I'm going to test your deep tendon reflex on your patella. So go ahead and relax there. If you can you distract yourself by pulling as hard as you can against your hands there. There we go. And if you'll take your heel and run it down your shin. Very good. And let's see. I'm going to check your plantar flexion. So I'm going to just tickle your foot here. And your toes should curl in. And the proprioception of your great toe. So go ahead and close your eyes. And I'm going to have you tell me if I'm lifting your toe up or down.
Up. Yeah.
And I do that bilaterally. Very good. Now we will check your cerebral function. So level of consciousness. So you can open your eyes. You're obviously alert. You can follow commands. And you can tell me your name, which is
Curtis.
And you can tell me the date.
5/6/17.
And you can tell me your birthday.
5/17.
And you can tell me the president.
Trump.
And you can tell me how's the weather today.
Rain.
And that's assessing past and present memory. Then math ability. What's 5 plus 4? Very good. And he's been talking and articulating during this process and following commands for logic and all of that. So his cerebral functioning is